Let's come to Johannesburg now, outside the Charlotte Maxeke Hospital. Heidi, I hope you're not about to catch that Gautrain bus, because we need you to tell us what's happening right there outside the hospital. As people are reflecting, there's been many lessons, I'm sure, that the healthcare sector has learned, and some of them very hard in the past year.
Most certainly, Braden, I'm not going to catch this Gautrain bus, but I think it just shows you how busy this section actually is. But just speaking with regards to that day last year when we heard about our first COVID positive case in South Africa, and of course in Gauteng, it was about 2 days afterwards where we heard about the COVID positive case here in this province. And of course, everything changed from that day on. Braden. Of course, livelihoods were taken away. People have passed away because of COVID-19, and healthcare workers have truly been at the forefront fighting this pandemic. And we spoke to the head of the emergency unit here at this hospital, who says that they were initially very prepared for COVID-19. When they heard about what was happening in Wuhan, they started preparing, they started having discussions and lectures about what they could expect. But unfortunately, no one can really prepare for such a pandemic and such devastation. And of course, it's a very difficult time for healthcare workers, as they are at the forefront of this pandemic, trying to fight for the lives of many South Africans. And Charlotte Maxeke has been one of the hospitals from the very beginning that was declared a COVID-19 hospital. The hospital has indicated that they initially were inundated, they were overwhelmed, they did not know what to expect, and a large number of cases were referred to this hospital initially. But let's listen to what Professor Motara, who's the head of the emergency unit here at this hospital, told us about her experience when she initially found out that COVID-19 was here in South Africa.
So I think for us, the preparation for COVID started a lot longer than before the patient actually arrived on the 7th of March. When we first heard about the Wuhan outbreak, we started preparing and having meetings already in January and February. So by the time our first patient arrived on the 7th of March last year, in fact tomorrow will be a year, we had already put quite significant processes and protocols and processes in place. So while we were ready for the patient when we got the call on the Sunday afternoon last year, it was still the anxiety and the shock and the panic of what we were going to do, because we really at that stage didn't know what we were dealing with. It was still very much an unknown entity. What we did know was that it was highly infectious. So, we got called in on a Sunday afternoon to say the first patient from Gauteng is arriving at Charlotte. We as a designated COVID hospital, and, all of us made arrangements. There was a team of people involved, our infection control, the internal medicine doctor, Dr. Jared Zamperini, and his registrar, myself and one of my colleagues, Prof. Abdullah Lahe, and then the entire infection control team that were there on the ground waiting for the patient.
Professor Firoza Mutala there from Charlotte Maxeke Hospital. Heidi Giokos, Mawande Keswa, and Aisha Ismail, thank you very much. It's been a good, solid start to the last 20 minutes of today, the first hour of the Friday edition of today. Thanks to you guys on the ground. They're doing a brilliant work, and I'm hoping that you're going to continue to do so during the rest of the day. Thank you once again, Aisha.